Namaste viewers, welcome to the Facebook live session. On the occasion of World Brain Day, our topic for discussion is brain health and prevention of brain disease. And for our discussion, we have with us Dr. Sudhir Kumar, Senior Consultant Neurologist at Apollo Hospital, Jubilee Hills, Hyderabad. Dr. Sudhir Kumar is currently working as a Senior Consultant Neurologist at Apollo Hospital, Jubilee Hills, Hyderabad since 2004. He is one of the youngest to qualify as a neurologist at the age of 28 years. Dr. Sudhir Kumar has an experience of over 22 years in managing patients with various neurological disorders. His areas of expertise include brain stroke, neurocritical care, epilepsy, neuropathic pain, dementia, and migraines. He is also an expert in administering Botox injections for neurological disorders. Welcome, Doctor, to our Facebook live session.
Thank you very much for the introduction.
So starting with our questions, so doctor, could you please brief our audience why is World Brain Day celebrated?
First of all, I wish all the viewers who are listening a very happy World Brain Day. And World Brain Day is celebrated to create and raise awareness about brain health as well as brain diseases.
So why was July 22nd chosen to celebrate World Brain Day?
So World Brain Day was decided to be celebrated on July 22nd. It was chosen by World Federation of Neurology, and that was started on July 22nd way back in 1957. So that's the organization about 65 years old, but about 9 years back they decided that there is very low awareness about brain and brain health. So that they selected to celebrate World Brain Day from July 22nd, and now we are in the 9th year of those celebrations.
So doctor, what is the theme for this year's World Brain Day?
This year's theme is brain health for all, which means that everybody in this world should receive the best care for the brain diseases, and everyone has the right to get full education about brain disorders and brain health. And so this includes if by keeping the brain healthy one can remain healthy. That debate is always there whether brain is supreme or heart. But those debates aside, brain controls almost all the body functions, including their centers for the heart rate, blood pressure, breathing, and also all the cognitive functions. What differentiates a human being from other species, and also one human being superior, it's mostly intelligence and memory and other higher cognitive functions, which are again brain functions. So education is the key. Everyone has to know how to keep the brain healthy and how to recognize brain symptoms and take help of specialists at the earliest.
So coming towards the next question, how can one ensure good brain health? So how can one ensure good brain health?
So brain health can be ensured by taking care of certain simple things, and that includes sleep. So when we talk about the sleep, it is about 7 to 8 hours of sleep at night. And sleep not only re-energizes the brain and the body, but also it helps in consolidation of memory and learning, which happens mostly during sleep. It also improves the growth. Growth hormone is secreted mostly in the night time during sleep, and that will reduce the stress and the depression and anxiety. So the less the more we speak about sleep is the most important thing. And we know that because of various things like people are working late nights, their late night functions, and then time spent on social media. So all these have restricted our sleeping ability and sleeping quality. So one has to ensure good sleep amount. Second thing is to reduce the stress and the anxiety, and that also goes a long way in improving brain health. The third thing about is the where people have to take brain healthy foods to improve the brain health, and exercise also plays an important role in improving brain health.
So doctor, what are the best foods that are good for our brain?
So various foods are good for brain. Brain needs multitude of variety of foods. So one should consume almost all kinds of foods. Now coming to specifics, the fatty fish such as salmons, tuna, sardines, they are rich in omega-3 fatty acids. So that is very good for brain. Eggs are a rich source of vitamin B12, and again the regular consumption of eggs or meat will supply protein as well as vitamin B12. And then nuts, mainly the walnuts, they also have very good effects on the brain health. In the fruits, oranges, and also blueberries. So they are also having good health on the brain, good effect on the brain health. So these things should be regularly consumed on a daily basis to take care of the brain.
So our next question is, what role does exercise play in ensuring good brain health?
Exercise is extremely important. So exercise is, it's not only for the regular physical fitness and endurance, but it also prevents several deadly diseases and mainly heart attacks and brain strokes, which are, and also the cancer. So these three are the top leading causes of death and disability worldwide, and exercise has been shown to reduce the risk of all these three. And coming back to the brain, brain stroke and Alzheimer's disease or memory impairment are less in people who exercise. And the recommendation is that one has to do 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise per week to take care of brain health. That is the minimum. One can do more than that also. And exercise can be anything which you like. It can be running, brisk walking, cycling, swimming, or playing a sport. And the key is here is to be consistent. It is not that you do it for a month and have a target of losing the weight for of 5 kg, 10 kg. So weight loss is not the sole criteria. Even if your weight is normal, you still have to do exercises to get the benefits. And as I mentioned, the duration that has to be followed.
So doctor, could you mention some common diseases that affects the brain?
So I would like to talk about one is the stroke, which is the most deadly disease in the nervous system. So stroke refers to lack of blood supply to a specific part of brain, and people who suffer from stroke, they can develop many symptoms. In that, the common ones are the facial droop. So one side, the face will be paralyzed and it moves to one side. And second could be weakness of the hands. If you ask the person to keep the hands in front, one hand starts to fall down, so weakness of the arm. Then weakness of the leg, so the person may not be able to walk properly. They may have imbalance, vision impairment, hearing impairment, dizziness, so and sudden severe headaches. So these are all the symptoms of brain stroke. The key here is to recognize the symptoms at the earliest, because the treatment is time bound. One has to reach the neurologist or the hospital within the first few hours, to be specific 4.5 hours, because the clot buster therapy, where we give injection to lyse the clot in the brain, it works only in the first 4.5 hours. So, and that facility is available in our hospital and also many leading hospitals. But the key is to reach the hospital early, because if you reach beyond 4.5 hours, even after diagnosis, the treatment cannot be done, and then the disability takes several months to recover. And next to stroke, I would like to highlight about migraine, which is another common disease which occurs in mostly younger people, mostly in women. And people who suffer from migraine, they have headaches, and headaches can be on daily basis or weekly basis or sometimes once in a month. And headaches are severe because they have vomiting, they can't do their normal household chores, they cannot work, and because of this, they lose several days of work in a month also. So it's a disabling disease, because pain is something which no one likes, and it affects the work as well as students, they don't study properly. But the good thing to know is that there is treatment. So migraine can be treated. I see many people or many patients who have migraine, they feel that there is no cure, there is no treatment, and they don't seek help. And one such patient I remember, who had been suffering from migraine for almost 25 years, and because someone told there is no treatment, she never saw a doctor after initial few years. And then finally her daughter got a job in Hyderabad, and she brought her, and with 1 month of medication she was pain free. And she said, I've never seen this kind of life in the last 25 years when I've suffered from migraine. So this is just one example. There are several people who are leading headache free life with proper treatment. So if you have headaches, consult a doctor and get properly treated. The third disease I want to highlight is about the memory loss or the dementia. In our culture, it is like if someone is 60 plus and has memory impairment, we just blame it on the old age. But 60 plus is not old age. If 60 plus is old age, there are people who live up to 90 or 95 or 100 years. So one cannot remain in the old age for 40 years and blaming everything for that. So today 60 is like yesteryear's 40. And if someone is 60 plus and has memory loss, it is abnormal. It could be a disease. And the commonest disease we find is Alzheimer's disease, but there are many other conditions which can also cause memory loss. So if someone has memory impairment, don't blame on the age, consult the doctor. With proper evaluation, we can find the root cause, and treatment can make them get back the memory also.
So doctor, as we have seen many persons suffering from migraine, how can we prevent migraine and how can it be treated?
So I would, prevention is a very good question. Prevention is better than cure. So what are the strategies one can use to prevent migraine attacks? In that, there are three things which the patients have to do. Number one is to take proper sleep. So sleep at nights for 7 to 8 hours, and preferably they should avoid night shift duties, because the natural circadian rhythm says that one should sleep at nights and work in the daytime. So if we change that cycle, it is not normal. Occasional night shift duties may be fine, but avoid doing continuous night shift duties so that you can get a sound sleep at nights. The second thing is to eat food properly and on time. So there are a lot of food fads, and if someone is little bit overweight, they skip breakfast or they don't eat one meal. But that is not the right thing to do for even an overweight person, and especially for those with migraine. Those who don't eat properly or delay of meals causes the glucose levels to drop in the brain, and that can trigger migraine attacks. So eat food properly, eat on time. And third is to avoid stress or tension. If someone has stress, that also triggers migraine attacks. So these three things patients have to do. And finally, one has to look at some triggers. So there are some women who say, or some people who say, that after eating certain foods they get migraine attacks. In that, common things mentioned are Chinese food, chocolates, cheese, too much of coffee. So if someone has sensitivity to these foods, they can avoid it. So that much about prevention. And sometimes, despite following all these preventive strategies, one can still get headaches. So for that we have preventive medication. So by using certain tablets on a daily basis for a few months, one can reduce the number of headaches. And nowadays, if headaches are not getting better with tablets, there are also newer therapies that have been launched in India for the last 1 year, where once in a month injection is there. So but consult your doctor to start the right kind of treatment to lead the migraine and headache free life.
So doctor, what are the risk factors for stroke and how can it be recognized?
So stroke is a disabling disease, as I mentioned, and again here also it is important to know the risk factors, so that by taking proper care of risk factors we can prevent stroke. So what are the risk factors? In that, some are non-modifiable, like advancing age, family history of stroke. We cannot change the family history. We cannot keep our age same or become younger. So those things, they are non-modifiable. But there are many modifiable risk factors. So we have to focus on them, and they are the risk factors like diabetes. So if the blood sugar is checked, if it is found to be high, then we need to control it with medications and diet and exercise. And if somebody is already a known diabetic, then they need to do something called as HbA1c. It's a blood test which gives the average sugar value for the last 90 days. And that will, if it is kept below 7%, then those people have lesser prevalence of stroke. The second modifiable risk factor is high blood pressure. If the blood pressure is high, again it causes the blood supply to become less in the brain, and also other type of stroke where the blood vessel ruptures leading to brain hemorrhage or bleeding in the brain. Both are common in people with high blood pressure. So for them the BP has to be kept below 130/80, and that is what will take care of prevention of strokes. And the third thing is the cholesterol. If someone has high cholesterol, total cholesterol more than 200, or LDL cholesterol more than 100, triglycerides more than 150, so these are all risk factors for stroke. So again, if it is high, they have to reduce the fatty food intake, do more exercises. And the HDL cholesterol is the good cholesterol. If that is high, it is good, and there is no medication for improving HDL. One has to take proper diet and do exercise, and that will bring up your protective or the good HDL cholesterol levels to higher level. And obesity and overweight is another risk factor. If someone is having overweight or obesity, they should take care of diet and exercise to become normal weight. And sedentary lifestyle should be avoided. If someone is smoker, they should quit smoking. Alcohol also is not good for brain, so it is better to abstain from alcohol. Or if someone is drinking, then they should keep it to bare minimum and occasionally.
So doctor, is memory loss normal after the age of 60?
It's a very good question. Even though many of our families we feel that way, but it is not the case. So a person above 60 who has normal brain health will have normal memory. So if someone is losing memory after 60, there could be dementia. So they need proper evaluation by a neurologist and a neuropsychologist to find out the exact severity. And there are many treatable causes of dementia. It doesn't mean that everyone who has memory loss is having Alzheimer's. Even Alzheimer's has medications, but it could be just simple vitamin B12 deficiency. It could be thyroid diseases. If suppose thyroid hormones are less, one can develop memory loss. And then sometimes it can be multiple clots in the brain that and in the areas of memory. Many infections like TB of the brain or viral fever like encephalitis. So many brain infections also can cause, and all these things are treatable once we recognize and treat them. Sometimes surgical conditions like if somebody has bleeding between the brain and the skull bone, that can also cause dementia, and that is called cerebral hematoma. If the blood is evacuated, then the memories can improve. And if the brain water becomes more in a condition called NPH or normal pressure hydrocephalus, just by putting a small pipe in the brain to drain the excess water can reduce the pressure on the brain, and memory can improve. So there are many causes which are treatable. So if memory loss is there, don't blame on the age. Seek medical attention, medical help, and proper treatment can get the memory back to normal.
So coming towards our audience question, so why do some people who live extremely active and healthy lives still go on to develop dementia?
Okay, so the one is the any disease has got two types of factors. One is specific personal factors, and second is the genetic factor. So about 10% of Alzheimer's disease can be genetic. So if someone in the close family history had Alzheimer's disease, they can still develop dementia. And then second thing, it could be infections. Infections can happen to anyone. Even if someone is leading a healthy lifestyle, the air, they cannot stop breathing the air, and air is as good as or as bad for everyone. So if the air is infected, like say I mentioned about TB, which comes from the air, then another infection of the brain called tapeworm, which comes from infected food. So infections of the brain can happen to anyone, and that also can cause memory loss. And there are some rare infections also which are luckily uncommon, like it's called CJD, Creutzfeldt-Jakob disease, which can cause dementia. So, but of course the prevalence of dementia is lesser in somebody who's having no risk factors and leading an active and healthy lifestyle.
So what things can damage our brain?
Brain damage can happen due to injuries I did not mention so far, but accidents, road traffic accidents are a common cause of head injury, and we cannot overemphasize the use of helmet. So anyone on a bike should wear helmet compulsory, both the rider as well as the pillion rider. That can protect the brain in case of any accident. The second thing, those who are driving cars should use seat belts. So today road traffic accident is a major cause, and or any falls, so one should avoid falls. And other than that, I have mentioned the causes like brain stroke, so blood supply can be blocked to the brain, infections, and then so these are some of the common causes of brain damage.
Can aluminium increase the risk of developing dementia?
Yes, it can. And aluminium is something which doesn't degrade easily also. Like we keep talking about plastic, plastic is pollution in the soil, and water is creating havoc, and there is a lot of awareness. But similarly, aluminium also, it can stay for 300 to 500 years. So aluminium toxicity also is bad for our body, especially for our brain and also kidneys.
So how do I know if my headache is a migraine?
Yes, so like most conditions in neurology, we don't need to go for a test. Like if you want to know about diabetes, you have to do a blood test. Without that, you can't know whether you are diabetic or not. For a thyroid, again, you need to go for TSH test. But for neurological conditions, it is the history. So if someone has headaches, which is affecting one side of the brain or both sides, but that should last for more than 4 hours. If someone gets headache and which clears off in 10 minutes, it is not migraine. So minimum 4 hours and maximum 72 hours. That is the first criteria. Along with the headache, out of 4 things, 2 should be there. Nausea, vomiting. So nausea is the feeling of vomiting, but no actual vomiting. Vomiting is the actual vomiting. So And then other two are photophobia and phonophobia. So when they have headaches, they don't like to see bright lights, so they switch off the lights. They don't like any sound, even talking to someone they don't like. So out of these four, two should be there. So when someone has these symptoms, it is migraine. If it is not fitting into these, then it may not be migraine. It could be other headaches, like tension type headaches. If it is backside of head, worse in the evenings, no nausea or vomiting, and no intolerance to light or sound, it could be tension type headache. And there are some red signs, red flag signs, like if someone gets says that it is the most severe headache of my lifetime, then don't take it lightly. Seek the help of doctor. It could be a condition what we call subarachnoid hemorrhage, which needs urgent diagnosis and treatment. Or if someone is feeling too sleepy or drowsy along with headache, it could be a sign of pressure, increasing pressure in the brain due to various causes. So again, they need to see the doctor. If someone gets fits or convulsions along with the headache, or weakness of one arm, leg, or the face, so any of these additional signs, it's a red flag sign, and they should immediately see a neurologist and get a brain scan done to find the exact cause of headaches.
So doctor, how do I know if I have had a concussion?
Concussion is a syndrome which happens after head injury. So in head injury, definitely they will do a scan initially. So but in the scan, if there is no bleeding or fracture, but the patient appears little bit confused when he has dizziness, when he tries to walk, he'll be wobbly. There'll be some memory loss and confusional state. So all these things will start in a few hours or few days after the accident or the head injury. The good thing about concussion is that it is self-limiting and recovers over a period of time with rest, proper hydration, and proper diet. So these are the symptoms, and self-limiting in nature usually.
So last question is, what vitamins are good for brain health?
Vitamin B12 is the most important vitamin. It is required for the myelin sheath. Myelin sheath is the covering of the nerve cells, and so lack of B12 will damage the myelin sheath, and it can affect various brain nerves, optic nerves, spinal cord, as well as the peripheral nerves. So people with B12 deficiency can have say tingling, numbness in the feet, vision symptoms. They have visual decline, and also memory impairment because of involvement of brain. And so B12 is the most important, and of course all other vitamins also play an important role. Thiamine also is important. So thiamine deficiency also can affect the brain, and that can lead to say ataxia, which is imbalance, or visual symptoms, confusion, and that is more common in people who are alcohol abusers, and sometimes seen in also pregnant women.
So coming towards the last question, doctor, could you please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills, Hyderabad?
So Apollo has a comprehensive facility for treating neurological disorders. If you look at the team, it's a team of neurologists, neurosurgeons, neuropsychologists, and also not to forget physiotherapy, occupational therapy, and neurorehabilitation called APOCOS Rehab Institute. So it's a one solution for all neurological disorders: acute care, emergency, which is 24/7, neurocritical care, headed by a excellent and expert team, and round the clock facilities in the ICU. So this is about the doctors. If you look at the equipments, the latest MRI, CT scans, angiography, and also PET scan. It was one of the first hospitals in the Southeast Asia to get the PET scan, which is very important for diagnosing Parkinson's disease, Alzheimer's disease, which is available in our same premises. And latest stroke treatments like thrombolysis, thrombectomy, we have the expert team doing it round the clock. For Parkinson's disease, deep brain stimulation, which is the effective surgical treatment for patients who don't respond to medications, is also available. Advanced treatment for epilepsy, including epilepsy surgery, is available. So you name a treatment that is approved, So here we don't go for experimental treatments, like say some people say do gene therapy, stem cell therapy. For conditions which are approved by FDA and our DCGA regulatory authorities, all treatments are available under one roof.
So dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Sudhir Kumar and clarify your doubts. Thank you, doctor, for educating our audience in today's session.
Thank you, everyone.
Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.